enter the room.
Hello.
Hello, doctor.
Hello. Can you confirm your full name and age for me, please?
Yes, my name is Lucille Smith, and I'm 29.
Okay, Lucy, I'm Dr. Ibrahim, one of the doctors here in the surgical unit. I can see from my note that you were admitted following a post-op wound infection. Is that correct?
That's absolutely correct, doctor, and I'm not happy about this infection.
Hmm. Lucy, I can see that you're a bit upset about that, but not to worry. We'll talk a bit more about it. Is it okay if I ask you some few more questions so we can better understand why you're a bit upset today?
Yes, absolutely.
All right, thank you very much. Okay, Lucy, I just want to know what really happened in the first place when you had the surgery?
Well, they first told me that I needed the surgery to remove this, cyst from my leg, and that was like 2 weeks back. And then just 5 days ago, I started noticing that it started getting red. It was so painful. There was this really bad smelling discharge from my leg, and I had to get admitted in the hospital for that. I mean, it was so distressing for me. Do you understand how much of work I had to miss for this?
So sorry to hear about that. This sounds a bit quite challenging for you, and it's quite understanding for you to react this way, but not to worry. We'll see how we can look into it and address your worries. So how are you feeling now following
And
your admission?
I want to understand, doctor, how could my wound get infected? I need to understand that, this was supposed to be a clean procedure. They told me that it will be all done under complete sterility. And then how is it that it just got infected?
All right. Lucy, is it okay if I discuss with you so we'll be able to understand how come the wound got infected? Would that be okay with you?
Yeah, sure.
All right. Thank you very much. When you had the procedure done and when you were discharged, were you told about the wound care?
Yes, I was. I was given a few instructions to follow, and I did. I followed it to the last word.
Oh, well, that's very good to know. But there's another thing you need to understand, that sometimes some of the complications from wound, or from surgeries could be infections, which you had, unfortunately, and we're sorry about that. That was not the intention for you to have such
Nobody told me that. Nobody told me that it was possible. When they told this to me, they told me that it was going to be under complete sterility. I didn't know that this was possible. Now, how could you just tell me that after it happened?
Right. You see, usually the operation is done under sterility, and we try to follow aseptic procedure in the hospitals and to ensure that none of this come up. But following wound care, when we go back home, a lot of things could have happened. By chance, did you resume work after the procedure?
Yes, I did resume work. I mean, I had to go back to work. But that's
Oh, I
not my
see.
problem. This could, at least it should have been told to me. Nobody bothered telling me anything about all this. At least I could have been prepared.
So sorry to hear about that. And I could see that this has really impacted on you, and now you're back into the hospital admitted again. So how are you feeling currently?
Well, I'm fine now. I had to be admitted for this. They gave me antibiotics and, I'm fine now. But
Yeah,
I feel bad then. And I want to understand how this has happened.
okay. You see, there's so many factors that could have resulted into this. We'll be talking about it shortly. I'm glad that following your readmission, you were given some antibiotics and now you feel much better. Let me just ask, perhaps, how you feeling, like any fever, any pain around the surgical site?
No, doctor, I'm actually fine. I'm absolutely fine.
All right, good. All right. Apart from this cyst that you had removed, have you been diagnosed with any other medical conditions?
No, I've been usually very healthy.
Okay. And apart from these antibiotics you had in the hospital, are you on any other medications?
No, they gave me some antibiotics to have even at home when I took them too.
Oh, I see. Okay. And you took them according to how it was prescribed?
Yes, I mean, after the infection, they told me how to have it, and I did, and now I'm better.
Okay,
I mean, this time
good.
I had all the information, but I can't say this about the last time. In fact, I want to make a complaint. I'm not going to let this go.
Absolutely. Definitely, you have every right to make a complaint, and I'll
2 minutes
be
remaining.
you on how to go about this. But for this, I just want to let you understand that the hospital doesn't take incidents like this lightly. This will be investigated and looked into upon. I'll be documenting this in your case file, and I'll be filling the incident form about it. And I'll also signpost you to the patient advisory liaison services since you want to complain. Are you open to this?
Yes, absolutely. And make sure that I'm going to be making an official complaint. Is this something that happens very frequently in the hospital?
Usually, this is not what usually happen, and in the hospital, the infection control rate has been checked properly, and there could be multiple factors. It could be that the antibiotic was a bit resistant. That was why you came down with some infection. But the good thing is that you're fine now, and you've been
I was given
retreated already. Sorry
my
about, pardon?
I was given antibiotics after my cyst removal. In fact, they sent me home without antibiotics altogether. Only when I
Oh,
got the infection did they give me the antibiotics. Why did they give me antibiotics if that is something that they give?
okay, usually in the first operation you had, because it was simply a clean procedure, usually they don't give antibiotic, and because
And
of the fear of antibiotic resistance, this is when like your body develop resistance to the bacteria develop resistance to the bug, develop resistance to the antibiotics. So that in situation where you need them, the antibiotic would not work. So usually we don't give antibiotic in um procedures like that.
I'm no doctor. I just want to make sure it doesn't happen.
Move
Yeah,
on to the next station.
yeah, sorry about it. Oh my goodness.
Oh.
Give you leaflet. I don't know if you're supposed to give leaflet in angry patient.
Of course, you have to keep the patient informed. I mean, of
I mean,
any
okay,
potential.
antibiotic resistant or wound infection. Anyway, I'm not
All,
so concerned with this case,
not to worry. I know
but
the
I'm glad I did it though, at least to start with.
absolutely, yes, absolutely. This is one of the most difficult scenarios, especially
It's
because
difficult for me because I don't even know how to start, how to go about it.
I understand. I completely understand. So definitely, first thing, this is so angry patient usually comes in two kinds of scenarios. Where the patient is angry right from the beginning, or the patient becomes angry after shed some light on some news that you have to give. All right. So that's why we've divided it into two sections where it's angry from the beginning and angry after disclosure. So this is an angry from the beginning station where it's going to be difficult to do data gathering. They're just going to be screaming at you, right? So the important data gathering that you need to do was you need to understand the incident properly. I don't know if you've understood from the scanned information exactly what happened, because cyst removal surgery was 3 weeks
Three
ago.
weeks ago, yeah.
She was admitted 3 days ago, right, with a
Mm,
wound infection and was treated with antibiotics and is fine now.
yeah.
That's the timeline you get. You have to confirm the timeline with her. You need to understand why. I mean, what is the timeline and what is the correct, sequence of events that has happened, right? Now, she's had a cyst. Is the usually any cyst, when is the cyst operated? You need to understand that, like, why was the cyst operated? Because if it's just a cosmetic thing, they don't usually operate it. So you need to understand a little bit about the cyst, like where is the cyst, was it infected? Was it causing pain? Was it causing any mobility issues? You need to understand why the cyst was infected in the first place. All right. So gathering that information is very important. So she would have said, I don't know if it was infected. I don't know all about that, but it wasn't causing me pain, but it was causing me problems in movement. That's how I've made this case. But it's always important to gather why the cyst was in, or else they may just say, I don't know. I don't know why it was in. The doctor suggested, and I agreed. Fine, just gather how much information you can, because most of the time these people will be just screaming at you. And it's difficult to get information. All right. After gathering the first information about the first surgery, all right, now understand what were the complications that were explained to her, because this is a part of the consent taking. You are required to explain the surgery and the complications that can follow. Right. That was the main thing. That was the point of this case. In this case, she was like, why wasn't any of this explained to me? Why didn't anybody tell me that this could be a likely complication? So you are looking at all the things that have gone wrong that could have caused this infection. Number one was she given the complication? Number two, did she return back to work? Number three, was wound care given? Number four, was she given antibiotics which she complied to? Number five, does she smoke, drink? What's the activity like after the thing? So you are trying to understand what could be your positive, finding for this infection, so that you can give an explanation for it. But from what you spoke, you understood that nobody told her about the infection possibility. So after you understood that, your response should be actually, I'm so sorry that nobody did. You have to agree that it was a mistake. So when a mistake has been committed, the first thing you need to do is agree to that. There is no point in saying, oh, sorry, usually this is usually that. That is just, over explaining yourself. You're just trying to, come up with a reason why that happened. If somebody makes a mistake and you agree to the fact that this was supposed to be done, and I'm so sorry that nobody explained this to you, this was a mistake on our part, I will make sure to document this and communicate this with my team. By actually doing that, you are kind of, agreeing to them. They kind of, tend to become more relaxed when, whatever they have come for has, has been validated. Right. So by
exactly. And I think you were trying to direct me when you said nobody told you, they didn't tell you all this, and I didn't get the clue you were giving me.
Actually, they will keep on that fact that why wasn't I told? So the best thing is to just accept it when you understand that there was a mistake, because technically it is a part of your consent. You are supposed to be explaining the complications, right? And then she was like, why wasn't antibiotics given? Is antibiotics given in all cases? This, is not true. So the
No.
first thing you actually have to ask is, was it actually infected before, the surgery? That's why you really did. That's why it's important to do a data gathering. Like, was the wound infected? What was the purpose of actually getting the surgery done? Because cosmetic surgery.
Doctor, where I got confused was, am I supposed to ask her about the condition that made her came the first time and had the surgery, and ask all that? It was like scattered in my head. I wasn't sure what to do.
That's the thing, right? You need to put the timeline. So reading the information, that's why you have 1.5 minutes to read the information. It's of very utmost important that you understand what the task is, because they are also trying to test you if you're reading the notes. So the candidate information is very similar to the patient chart. So even if you're going to meet a patient in the consultation room, you'll have some information about them, and that is the candidate information. So after reading this, what could you understand? From what you've understood, you have to clarify it with her. You have to clarify the timeline. So what came first? First was the cyst that was removed. Why was it removed? Have that understanding. All right. This was removed for this reason. Was it infected? Was it not infected? All right. Was she explained everything regarding the procedure? All right. After the procedure, what happened? Was she given antibiotics? Did she return back home? Does she smoke? Does she drink? Is there any risk factors that could cause the infection? Did she do wound care properly? You know, those are the questions that need to be happening in your mind to understand why the infection happened. Now, after that, you realized 5 days later. So the cyst removal happened 3 weeks ago, and she got admitted 3 days ago. All right. So before the admission itself, when did she start noticing that there was, you know, fever, flu-like incidents, and there was some pus, reddish? When was the first sensation she started having that? She'll say it was 5 days ago that I started feeling that it was getting, painful. There was some discharge and all that. So, 5 days ago she started feeling this, and it only got worse so that she needed to get admitted 3 days ago. What happened in her admission? She was treated with antibiotics, and now she's fine. And you've also asked that she got, and then she also said that I was even given oral antibiotics. So you know that there was a continuation of antibiotics IV, and then it was changed to oral, and she was sent back home, and now she's come back after 3 days and she's complaining to you. So this is the timeline. Do you get it? This is what you need to do in the data gathering. This is what you needed to gather so that you have the right information to give her. All right. Now, so what you identified mainly is that there was a mistake that nobody explained her the complication of infection. And you are going to say sorry for that, not saying that I'm sorry. I'm like, extremely sorry on behalf of the team that this was not communicated to you. This is a very important information that should have been told to you. I agree to that fact that, I understand that you're mad because you weren't told, and this is something that needed to be told. All right. And we are going to do everything in our power that this does not repeat itself. I will put out an incident form. We will have an internal discussion on, the practices of, explaining the complications of surgery. You can actually talk about that, and I'll get my seniors involved, so that they know that this has happened. So that way you can actually, tell them everything. So that is the management to the mistake that was made. So you've understood the mistake, you've given the management. Now you have to look for any risk factors that could have caused the infection, right? So you started asking wound care. I did wound care. Were you given antibiotics? I wasn't given antibiotics. Why wasn't I given antibiotics, right? So that's why you can say that usually in a procedure that tends to have less chances of infection, they tend not to give antibiotics. Again, that whole resistance thing that you explained very well. Good job. That usually if there is low risk of an infection, they tend not to give antibiotics, because giving antibiotics so frequently can cause resistance for different bugs towards that antibiotics, and in the future it cannot be used again, right? So something like that, just give an explanation for that. And then after that, understand a little bit more, like, did you go back to work? She said, yeah, she went back to work. So that's again something you can bring back in management, saying that usually when a surgery is done, you are expected to take a rest, take a sufficient amount of rest so that your body recuperates, right? And it comes back to normal function. You can say it in those kind of words, and then understand if she has any smoking, alcohol habits which can add on to the risk of infection. You can say them as talk about them as risk of infection. You spoke about any medical conditions and medication. That's very good, because that can add on to the risk of infection. Because if she has diabetes, that's again something that would be causing her infection. Right, those are the things that you needed to identify, and you did. Good job. And that is something also, if you found positive findings, you will bring back in management.
Yeah, but I didn't ask her social life, if she smoke or alcohol, because those could also affect wound healing, I guess.
Sometimes you miss out a few points, it's fine. But keep it in mind. I mean, have an approach. Like, this is how you're supposed to approach it. But you are needed to. So that's the thing. In this case, you will be so scared to talk to the patient that you.
Yeah, to be honest, I was a bit scared. You're doing your reacting, and I think I like it. At least it's made me like okay. It can be like this in the exam, because you have gone there, you've seen it, you know it all, and it's good. At least one will be able to be prepared.
In the exam,
Thank
I guarantee you, if it's an angry patient and if it's a face-to-face angry patient, you'll come out crying. They'll make you literally, you will end up shuddering trying to talk to them because you're trying to ask them a question, and every question that comes out of your mouth, they're just barking at you. It's the most thing, trust me.
I would say I'm having cold feet while I was doing it.
Yeah, aggregation is one of the most difficult stations, but that's the thing. You need to understand your role and what information you need to gather and bring it in the management. All right, so good job. We will look at the performance. Dr. Mishi, were you able to mark?
Please let me see my mark.
Yes, I was.
Absolutely. Oh wow, data gathering is also.
No, this marking is not correct. I don't think this marking. 4 points in that data gathering.
No, I think she marked it according to the points because you actually did cover all the points. Good job. But I would reduce marks over here because it was not organized. Your thoughts were not organized. It wasn't structured. Ask me.
Yes,
Yeah.
actually, it was not
I
structured.
wasn't
I want to
organized.
mention it.
But I think you did
I
cover
wasn't organized.
Yeah, because even I could understand that you didn't understand the timeline of events, and that's very important to understand. You know, in order to actually understand what has happened to this patient. Even by the end of the consultation, I don't think you understood properly what happened to the patient. So definitely, I would reduce a few marks, but I think I would give you a 3 because you asked me almost all the questions. You asked me for any risk factors. You asked, except for the alcohol, I think you asked me everything. But just because your thoughts were kind of disorganized, I would actually reduce marks on that front. Management, all right. Apologize for the situation. This is something you never did. Actually, I would reduce marks. At no point did you say sorry.
Because at the end I was doing it, but I didn't do it well. Like you, the way you said it, apologize on behalf of the team. But I was saying I'm sorry. I didn't do the sorry properly. It's supposed to be on behalf of the team. So I don't think I deserve a mark on that apologies that I gave.
The point is not to apologize. The point is what are you apologizing for? Which is the point that you identified that was a mistake. There is a difference between apology for the teams that you feel this way. I am so sorry that you're feeling this way and apologize on behalf of the team. And there is a difference and when you are actually apologizing for something that you know might have gone wrong. So in this case, which was the point that was actually a mistake?
I apologize that she had this infection and that she wasn't told about it, that the hospital doesn't take it lightly. It's going to be investigated and I'll be filling the incident form and I'll be reporting it.
Any other points? Our mistake is not to inform. Absolutely, Dr. Sumit. That's amazing. Yeah. The information
Our what? Can you say it again?
Yes. So Dr. Sumi has also written it on the chat. You guys can check it out. But the mistake that was made, that you identified, was that she wasn't explained that this is a likely complication. That was a mistake. You need to apologize for the fact when you figure out that this is something that was supposed to have been done and it's not. So first of all, I'm so sorry that you're feeling this way. That's all right. But I am extremely sorry that this information was not communicated to you. The risk of infection. Infection is a very likely risk given any surgery. You and I know that. The patient doesn't know that. And nobody told her that. And that's wrong. So that's why you're apologizing. I'm extremely sorry that this was not, made clear to you. Yeah. So other than not making errors, yeah, amazing. So that is something that you need to explicitly apologize for because you've understood that that was a mistake. So you're also trying to show the examiner that this is the real kind of practice that is practiced in taking consent, and I've understood that nobody explained this to her. So I'm making an apology on behalf of the team for, having done that, not having done that. Unfortunately, complications, yeah. Explain why antibiotics is not prescribed. That's nice. But also you mentioned promise to investigate, connect to pals. Yeah, that was good. All right. Discussion contributing factors. From what you've told me, I understand that you had to start working immediately after the surgery. and also that you smoke regularly. That could possibly contribute to improper healing and increases chances of infection. Yes, that's also adding on to the data gathering that you also found out that she's gone back to work, right? So that's also something you could have brought back in management, saying that from what we have discussed, I've identified that this has happened to you, and that is also kind of contributing to the improper healing and the likelihood, the increased risk of infection. Offer education whether I can provide you some leaflets and pamphlets that you can give more information, that you can get more information on what to do and what to avoid, especially after the period after surgery. That's one way. That's that's her leaflets and pamphlets. Arrange follow up, explain, and then you can tell her,
Dr. Anand, please, I have a question there about what will happen after. So is that not medicine after death? Because the surgery, we're not expecting her to go back for the same surgery, but this is just to give her general knowledge, because at that point I was a bit confused. Leaflet for what?
Yeah,
Antibiotic resistance or wound infection or what?
Anything, whatever is relevant. You have like you have a bunch of leaflets. If with my conversation I feel that this is something that is important for you to know, I'll give you leaflets on that. Right? It depends upon what you put leaflets on, right? Whatever she wants to be informed. If you feel antibiotic resistance is actually an important discussion you were having, you can actually say that how about I give you some leaflets and you can understand a little bit more about this. And in the future, if you were to have any surgery and if this situation were to arise, how to manage the wound, I can give you some informational leaflets on that. Right? Informational leaflets on every topic is there in the test. So be sure that whatever you're talking about, whenever you have to bring out the leaflets and pamphlets part, there is definitely one made. So this is a way where you are assessed on if you are keeping your patients informed, because otherwise you're going to go and seek information from unreliable sources. You are giving them a source, a reliable source that can actually give them information, right? And you want them to have correct information instead of actually believing in all the hoax. Yeah. Maybe leaflets on how to reach pals. There you go. Not bad. Why not?
So that I'll give her 3 leaflets, one for antibiotic resistance, one for wound infection, how to care for, and one for pals.
Anything that you want to know about. Like, how about I give you a leaflet so that you can even continue reading about it. And if as for no, there's only so much that you can take back from a consultation. Out of what you have discussed with the patient, they might actually remember only probably 30% of what you've discussed. They tend to forget things because it's human nature. So the only way they can retain it is if they have some material to read it back, right? You can just simply say that how I give you some leaflets on on what we have, on the topics that we have discussed, so that if ever you want to refer back to them, you can. It's just a simple way of saying that, and then you can give all the leaflets that you want. You want antibiotic resistance, go for it. You want wound infection, go for it. Yeah. And then provide safety netting and information for if the symptoms do recur again, definitely, and set up a follow-up. Good job. Signpost whenever required. Yes.
Okay. Sorry, before we leave that the management point about safety net, in this situation, she's already angry. What am I going to safety net her for?
So you know that she's had an infection, she has a wound, right? Definitely there's a wound. So you need to make sure that the wound is healed.
Related to the wound, if in case it started becoming painful or something like that. Okay, good. Because the case is a bit tricky for me, like I have to ask what happened the first time, why she had the surgery, if it's infected or pain or whatever that led to the surgery, and what happened during the surgery, what was told to her, all that, it's a bit tricky. You have so many things.
Yeah.
But I'm so happy I did this, to be honest. At least it opened my eyes. Thank you very much, honestly.
No problem, doctor. That's what you are here to do. We are here to discuss our consultations and understand exactly, how do we extract information from our patients? How do we get to the bottom of something? Every question that we ask needs to have a reason behind why we are asking it. I understand that you guys are reading a lot of materials from here and there. Everybody tells you to do Socrates, everybody Odipara, and Primaptosa, but not every question is important. You need to have like a thought process of behind every question that you're asking. With every question, you're ruling out a differential. Only when you're doing that, you're actually having a real consultation, because when you go into a consultation, you hear a presenting complaint, you're elaborating to understand where is it, you're trying to localize it, and you're trying to understand other symptoms, and then you're trying to understand all the complications that it's causing in their life, because you're not treating the disease, you're treating the person, and then you bring it back in management in whatever you've gathered. And that's a very personal style, because everybody has a different sort of thought process, and you need to learn how to explore that thought process, and exploring that in a conversation is what they're testing you. All right, so definitely guys, do ask your questions, be critical about everything. I know Dr. Ibrahim keeps me on my feet. I really like that.
I'm so sorry, Chief, but please, you make it a lot more interesting and more, giving us hope. For me, it gives me hope that I can do it, I have one question.
Yeah,
it might sound silly to others, but please, I keep listening to people presented, like, the opening sentence while you enter introduction. So I noticed I missed something there. Like when I called the name, like when we come in and the patient is there, are we supposed to say, call them by their full name and ask them to confirm their age, or ask them to tell us their name and their age, and ask them what can I call you, or how do you want me to address you? Please, what's the proper way? Because sometimes for me, that entrance is a bit shaky for me. And once I'm a bit disbalanced, it just show all through my presentation. Yes.
Absolutely. Actually, that's a very good question. In fact, that's also something that I learned, over time. So what I do is, just for the sake of saving time, I always use the information that I have. So if you see this case, you have the information, Lucille Smith, 29 years old. So I use that. So I try to, and then I look at what she's admitted for. So just for the sake of time, I don't start with, may I confirm your name and age? I start with, hi, am I speaking with Lucille Smith? Then their answer is relatively short. They'll be like, yes. Like, can I please confirm your age? Because these are the identifiers to identify if this is the right patient. What if there was another patient called Lucille White? So if I just go with the first name, it's not good. You have to say the full name, because these are the identifiers that are given to you along with the age, right? And then she'll say, yeah, I'm 29. All right, thank you so much for confirming that. I can see from my notes that you have readmitted with a post-operative infection. I'm so sorry to hear that. Can you tell me a little bit more about this? So I use usually everything that is given to me, so that my first question is an open question, saying, please express yourself. Tell me what is going on. Right, because they will, I always make them start, I always make them say it as an opening statement. That way they can express themselves in the way they feel what is wrong. Right, and that is exactly, I feel that, everybody, when they actually have an issue, they have a way of, describing their issue. And that's what you want to hear, like, what is your description for it? And then narrow it down, So yeah, so that's what I use. And so how may I confirm, or how may I call you is also a good name, because most of the times, you might get a difficult name and you might not know how to say it. So it's a good way to actually. So you can always ask them, am I saying that right? How may I address you? That's always something you can always ask. Sometimes you might not really know if that is pronounced properly. Give it a shot, give an attempt. That am I saying that? Am I speaking with Lucille Smith? Am I saying that right? And then she can, clarify if it's wrong. Usually in UK, if you say a person's name wrong, they get very offended. So it's best to hear from them how they say their names, so that you can just replicate rather than make up. So
another question is, since it's a two name, can we ask them what do they prefer to be addressed at, to be called for the purpose of the conversation?
Absolutely. That's actually a good question, in fact. How would you like me to address you? Because for the rest of the conversation, you have to call them by something. It's a good way.
Okay.
But usually this question actually becomes very important when it comes to these gender dysphoria cases, LGBT cases. So they end up having a different birth name, and they end up having a different name that is getting used at the moment. So you have to confirm both of it. Just for the purpose of confirmation, I'd like to just confirm your birth name. And then she'll say that, he'll say that, and then just be like, how would you prefer I address you? And then they'll tell you how. And then just make it sound normal. That's the whole point, Don't make it sound too obviously, that it's kind of throwing you off. And you're just asking, like, how would you want me to say it? Sometimes if you notice I had a friend back in school whose name was written a certain way, but she liked to pronounce it in a different way, and she got offended if somebody pronounced it in the way that she didn't prefer. So that's what you're trying to see, how do they prefer to be called? That's that's important, because you address them like that. All right. So yeah, we were looking at the performance. Okay, is everybody clear with this case? Yes. And another thing, doctor, if this patient is in front of you, even though she says she's all right, it's good to examine the patient, because she might be having some subclinical signs that may go unnoticed. You cannot leave that to chance, especially when the patient is in front of you. You have to identify if there are any subclinical signs. So it's very important that you actually examine patients, especially when they have an issue that they have come with.
All right.
Yeah.
Okay.
All right.
The examination will involve checking their vitals. Is it just okay to say vitals, or we say I'll be checking your blood pressure, your pulse rate, oxygen saturation? I'll be taking a look at the wound operation side.
You specifically say what they are, because the person who hands you this is the simulator. All right. So now the simulator will only hand you the findings if they understand from you what the findings are, what you're looking for. So if they hear the word, then only will they give you the clipboard. They'll have clipboard. So it's better that I'd like to look at your vitals, including heart rate, blood pressure, BP, saturation, and temperature. And then, general physical examination. And specifically in this case, I'd like to also examine the wound to see how you're doing. Right, because vitals kind of give you an idea of systemic involvement, and that's something that you do not want to miss out in any case. All right, awesome, that was great.